Carver, superintendent of schools in Bethel. I'll introduce her more formally in a minute. Bethel is getting their schools opened in about a week, and tell you a little bit about some of the unique things they're doing there. I was really impressed. First off, it's been a few days since our COVID update. I think still good news. We did 45,000 tests. We had a positivity rate, again, of less than 1%. It's 0.8%. That's 3 months running. That's extraordinary, I think. Hospitalizations are down by 8. Remember, we were up at close to 2,000 during the peak. So these are all the metrics we needed in terms of being able to open schools and reopen our state in a cautious way. You know, that said, I met with the legislative leadership today, and we're going to have an extension of the emergency powers for another 5 months. It's an extension of the public health and civil preparedness going through February 9th. Leaders thought February 9th was an appropriate time. They'll have been back in session for about a month and ready to start voting on things and get back to regular process from there. I got to tell you, you know, when it comes to public health, we're on a different track, and that's why I really appreciate the confidence legislature had in me giving us those emergency powers, because we had to move fast. You know, especially in March and April, where things were breaking really hard, and we had to be able to react quickly in terms of closing down schools and you know, restricting access to stores and the such, doing everything we could, I think with some success, to hold down the rate of infection. And I think you've seen the benefit of that going forward. And now we're on the other side of that curve, fingers crossed, as we continue to reopen. Obviously, we started May 20th. There was some caution about were we reopening too fast or too slow. And here we are today with the good numbers we've got. Schools reopening. We've given Miguel Cardona, our Commissioner of Education, a little bit of flexibility there. The power is able to do additional work, what we're doing in terms of providing all the testing en masse as needed there. Flexibility to the hospitals. That was one of the emergency powers we had that was so important. Back when, if you can remember, it seems so long ago, it was just a few months ago, we were just reaching the top of the bathtub in terms of the water overflowing, in terms of number of people in our ICU. And we had to build out the field hospitals. We need to get additional nurses in, and that required some emergency work to be able to change the certifications, relax some of the codes so we could do that quickly. I hope that does not happen again, but we're ready as needed. Nursing homes. I mean, one of the things we did with our emergency power, unlike some of our neighboring states, I think to their regret, was those who test positive for COVID, you're going into a separate facility, a COVID-only facility. Those are the type of latitude that the emergency powers gave us. Rapidly procure the PPE. I mean, if you can remember back, we were scrambling. We were scrambling all over China, all over the globe, doing what we could to get the PPE, mainly the masks, mainly the N95 masks. And if we had to go through the traditional RFP process, we'd still be waiting for those masks. So, look, I appreciate the fact that I hope we're going to be able to get those powers extended, you know, at least, you know, for the next 5 months. I think at most for the next 5 months, because I'd like to think we're on the backside of COVID, back to regular practice. And in the meantime, the legislature is chock-a-block working on the energy bill and a number of other key initiatives that are going to come up in the special session over the next week or two. Let's see, moving along, the testing overview. I thought this was sort of interesting, just so you can see how our testing has ramped up over time. We've been averaging, you know, about 100,000 or close to it over the last, you know, few weeks. And you can see that red line. It's a little faint here, the positive number of positives. More importantly, that overall line going down dramatically and staying down over that period of time since we started reopening, which is sort of ironic. And finally, let's talk about why these good numbers give us the opportunity to get back to school. I was interested that Randy Weingarten, who runs AFT, one of the leading teachers organizations, associations, unions in the country, it said you can't get back to school safely unless your positivity rate is less than 3%. Well, we're less than 1%. So I think that's a pretty good sign. I did notice that Rhode Island today, my friend Gina Raimondo said, many schools are going to open full-time now, but I'd like to see all schools open full-time by mid-October. But one school that's going to be opening a full-time very soon is Bethel. And that's why I've asked Christine Carver just to talk for a few minutes about what's going on there. She's one of the 30% of our schools that are going to be reopening full-time. Most of those schools opening full-time are sort of rural, some suburban, a little less likely in the urban areas. Almost 30%, 28% are starting hybrid with a plan to shift. So, schools like Bridgeport, largest school system, they're going to be hybrid for the near term. Within 2-4 weeks, earn the confidence to get open on a full-time basis. Another 41% of schools are going to open hybrid for the foreseeable future. And I'd like to think, like in Rhode Island, people are going to build up the confidence. Teachers will have the confidence. Parents will have the confidence to get their kids back to school on a more full-time basis. And 1% of our schools are going to open just distance learning for the foreseeable future. One of them is Danbury. I think you remember Danbury had a flare-up. They went from 1% to 7% positivity. A few days later, they were down to 5%. Now they're down to 3.4%. We came in with the testing. They were really good on the quarantining. So I think you see we've got the ability to deal with their flare-ups when they come up. So I'd like to think that Danbury will be off the full-time distance learning curve pretty soon. And that would leave only New Haven, which is still on the distance learning metrics. But with that, Christine, I'd love to see what was some of your thinking. How did people in Bethel earn the confidence to go back to school full-time? And what would you tell to other schools that are listening in?
Thank you, Governor, for having me today. And we're just pleased to be part of this press conference. And I think what makes Bethel unique is the commitment of our teachers and our administrators as we welcome about 3,100 students back this fall. About 18% of the families are going to be on distance learning in the for the fall. But as you know, we are doing what's called a transition to full. So it is our intent to bring back, start in a hybrid and bring back our elementary students K-5 by September 29th, our middle school by October 5th, and then look at a date in October, early November for our high school to transition fully back. And I think part of the reason that we have confidence of our parents and our staff is the preparation and the careful planning that we have taken to implement any of the 3 phases of the plan in Connecticut, including making sure that we have the appropriate PPE for all of our staff and for our students if needed, to making sure that our ventilation systems have been adequately checked and updated because as you know, ventilation is a key component of the mitigation of COVID. Also, looking at our social distancing within schools and ensuring that we can space students, and we think we confidently can, close to 6 feet in our classrooms, but really looking at outdoor instruction. And it was a big thing that we emphasized with our families as we began our planning moving forward. And so we've done things like buy tents so that we can maximize at each school outdoor instruction to get kids acclimated to some of the mitigation strategies also. And we know that it's a better environment for our students. So working on creating opportunities for our students that are at home, making sure that we have hotspots available for our teachers if they are engaging on outdoor instruction. We have been one-to-one in Bethel for a number of years, but we have expanded that all the way to pre-K. So regardless of the environment the student is in, they can engage synchronously with their teachers within the classroom throughout the courses of the day. So those are all key components. And also, as you know, when you visited the other day, we had a very successful summer school program this year. So the use of masks is obviously of key importance. And we had some of our most disabled students learn to wear masks and wear masks for extended periods of time. And that confidence that we have built, whether it's conditioning through athletics or in band camp, because we know that our students want to be back in school. We know that working with a teacher in the classroom is the best environment for students to learn, and the relationships that they have and developed have become so important. And what we're seeing as people are getting back, they're becoming more comfortable. They're seeing the mitigation strategies that we have implemented, and that has been certainly a key piece to that.
Very interesting. And you mentioned that probably 19% of the parents are choosing to keep their kids at home. At the same time, it was interesting, you're going to have 100 new students in your school than you had before, which is a trend we're seeing around the state, where we've had close to 25,000 New Yorkers who have formally changed their address from New York, mainly New York City, to Connecticut over the last few months. 100 of them are in Bethel. Are they mainly from New York? And for those folks who are not coming to school, Christine, what do they do for free and reduced lunch if they're in that category?
Sure. So yes, we are seeing, I think it's between 75 and 100 new students enroll since this year, which is much higher than normal. Bethel's been steadily increasing in our enrollment over the past several years, but we are seeing a good number of people that are moving from New York City, Westchester County, to Bethel, and it's certainly a trend that definitely has been amplified this year. So that's something that is definitely true. And with regard to free and reduced lunch, so we will continue to provide the program. We served about 72,000 breakfasts and lunches in the spring when we closed for COVID through the end of June. We were able to extend the program through June. And we are also, because we have a phenomenal food service staff, we are also going to be providing free and reduced lunch students, breakfast and lunch, even for those that are on distance learning. So we've established a program for pickup during the day, and we've even extended the hours so in the evening for parents that do work but might have their children with an extended family member because they're not comfortable sending their child back to school right now. So we are even extending to some evening hours so that we can ensure all of our students in Bethel are fed.
That's great. Thank you. Max, any questions?
News 12 Connecticut.
Hi, Governor. Can you sort of go over more of what was discussed in this meeting with legislative leaders today in terms of extending out the executive orders? I mean, did they have any concerns, and how did you address those?
First of all, we addressed them by saying I want to stick within my lane and focus really on health care. And that's where we needed, given the COVID nature of this. I didn't want to broaden the nature of the emergency powers in any way, which I think was appropriate. I think that's what the legislature had intended, and I think that's what worked out. We also said, look, things are going fast and furious back in March and April. We did a good job, but we could always do a better job in terms of keeping the legislative leaders informed in terms of what we're doing, why we're doing it, what the consequences of doing it are. And, Paul and Bob, said we're going to continue to do that in an even more fulsome way, just to make sure these are full partners. They know exactly what we're thinking about.
And Governor, you mentioned the upcoming special session. Do you have a date firmed down for that yet? And what do you think is going to be on the agenda and what's not going to be on the agenda?
Well, I think they're talking about, they were hoping next week. Then I heard that may be a little bit of a push. Obviously, I think the most important thing they're looking at is energy, given what happened in terms of the outages now twice over the course of the last month. I, of course, have been leading with performance-based regulation, urging that you don't try and micromanage in terms of operations, but set out goals that you want the performance metrics to achieve, and then let PURA institute that. Any other priorities, Paul?
As you hear from the governor, the most important priority for a special session is really looking at utility-related reforms within the state of Connecticut, and the governor got that clearly across to the legislative leaders. There are a few other initiatives that the legislative leaders are talking amongst themselves, and they'll be reporting back to the governor, myself, in our office in terms of the overall direction for the session. Until that time, and where there's a finality in terms of not only the topics that will be taken up, in addition to what the topics in the bills and the changes in the law will be, we will be waiting before we put out an order or a call for a special session, but we are working very closely with the legislative leaders on that matter, and we'll be meeting with them again tomorrow.
What do you expect that energy legislation to look like? I mean, they've obviously proposed a pretty broad slate of reforms. I mean, are we looking at mandated refunds for customers? Do you think that one of the bills might be, performance-based rates of return?
Look, obviously there's been a lot of talk about refunds, but I think more broadly right now, reliability and restoration and speed of recovery is front and center. And we want to make sure that the utilities have all the right incentives in place to make sure we get your power up and operating as soon as humanly possible, and penalties when they don't.
Thank you, Governor.
Channel 3 Eyewitness News.
Good afternoon, everyone. As you guys already saw a week or two ago, Massachusetts mandated that K through 12 students must get a flu vaccine by December. Is there any chance that Connecticut could be doing the same thing this fall?
Yeah, I think Deirdre, Acting Commissioner of Public Health, and Josh are looking into just that, and we'll be getting back to you on that soon. Obviously, look, the public health officials are very clear with us, and this is from the Trump administration as well, that flu-like symptoms and COVID-like symptoms are very similar. If they hit at the same time in, say, late October, November, that could put a lot of pressure on the system. So the degree to which we can reduce the number of people with, quote, flu-like symptoms if they've taken a flu vaccine will be very beneficial in terms of our healthcare system.
And last question, following the outbreak at Three Rivers Nursing Home in Norwich, are you guys or DPH considering any changes for visiting hours to nursing homes?
Well, I can tell you we got the initial report back, sent it to CMS down in Washington, D.C. They're going to look at this. There were some severe deficiencies that we're going to look at and hold people accountable. I don't think that, look, more to the point, all the other nursing homes have done, pretty well. This one, it was severe. We had fatalities and we had a high number of infections. But I think broadly speaking, I think the nursing homes, we're going to be able to open up a little bit along the lines of what Deirdre talked about last week, and allow loved ones to see their parents or grandparents safely, but a little more frequently.
Fox 61.
Good afternoon, Governor. You mentioned that 3% infection rate a few minutes ago. If you began to see districts around the state popping up over that 3% infection rate and their numbers began increasing, is there a point at which you would, at the state level, say, okay, everybody stay home, let's revert to distance learning for now, or is that going to be completely up to the districts themselves?
Well, we put in place, you maybe remember some guidance, some metrics going back at least a few weeks ago. We were going to do it on a county-by-county basis. As you saw what happened in Danbury, once that spiked up to 7%, it wasn't just that it went to 7%, how quickly it happened, and now it's coming down almost as quickly. So we're going to give a fair amount of discretion, you're right, to the districts, but we have clear metrics out there in terms of when we think it's time to pull back. Public health is still our key metric.
And also, do you think we have learned enough at this point and increased our testing capabilities enough at this point that if we begin to see a flare-up in the fall, that we could take a more targeted approach to containment and mitigation and avoid a shutdown like we had in the spring?
I do. Look, we've got we got at least a 3-month supply of PPE. Let's face it, we didn't have that 120 days ago. Josh was just joking, we may be looking for more warehouse space as needed. We've gone from being able to do 20 tests a day to you see now the hundreds and hundreds of tests that we're able to do, 100,000 in a week. So I think that gives you the idea we now have a lot more capacity, and I think we'll be able to deal with individual flare-ups just the way we dealt with Danbury over the last week.
Yeah, I mean, I think, As you saw,
All right, thank you, Governor.
In addition to Danbury, the outbreak at the nursing home in Norwich, the other situation we were tracking in East Windsor last week, those were all caught relatively early because of the ample testing that we have in place, the programs we put in place with our federally qualified health centers, the very proactive testing approach with asymptomatic populations that are at higher risk enable us to catch those. So we'll keep those programs up. We're going to keep them going, as the governor said last week, despite some of the changing guidance from Washington. And we have a lot of confidence that will give us the opportunity to spot those hot spots quickly and take aggressive action like we did last week in Danbury and elsewhere.
All right, thank you.
News 8.
Governor, with respect to the extension that you announced today, I'd lost you a little bit early on when you were talking about it. Can you talk about whether you really thought that there was a chance that the extension, you wouldn't have the ability for that extension, and what exactly it means, what it means specifically over the course of the next 5 months?
What it means over the next 5 months is that we'll have the ability to react quickly if situations change. Just like happened in April and May. I'd like to think that we're not going to be in that situation. We can be a little more methodical and cautious in terms of those EOs. It's worth remembering that of the executive orders we did, almost all of them, or the vast majority, were related to deregulation, making it easier for hospitals and schools and purchasing to do what they have to do quicker and easier. Smaller number were restrictive in terms of closings and the such. I think, and I think the legislative leadership, thankfully, agreed that this is a good way to go. It's worked for the last 6 months. It ought to work for the next 5 months.
And then moving forward with Three Rivers specifically now, what has to happen there moving forward, and has to happen very quickly, obviously.
What are the next steps there?
Three Rivers?
Yeah.
So the Department of Public Health investigative team has been on site, I think almost every day, if not every day, since this was first identified, working with the facility to ensure they were taking the right steps to remediate the deficiencies that were identified in their use of PPE and their cohorting of infected residents in particular. So we're hopeful at this point that actions have been taken to mitigate the impacts at this point.
NBC Connecticut.
Hi, Governor. Matt Austin with NBC Connecticut. Just going back to your October goal for a full return to school. We've talked to, of course, a lot of parents who have concerns about sending their kids back. If the health metrics now are potentially as good as they're going to be for quite some time, what is your message, and what can the state do to give parents confidence about sending their kids back?
I think just what we're doing, Matt. You'll be able to look at Bethel. You'll be able to see what their what progress they've made in terms of hybrid, moving to full-time. You'll be able to see 30% of other schools which are full-time. You'll have a better idea of where our healthcare metrics are. Are they as good in a month as they are today? Look, I found with hair salons and some other situations, maybe it took a little while to build up people's confidence. And so far, I think the schools have earned your confidence that we can open safely.
And also, right now, UConn is reporting 58 current cases of COVID. Last week, Governor Cuomo announced that if a college had 100 COVID cases, that the college would have to go remote for 2 weeks. Is Connecticut considering doing something similar?
I think what Governor Cuomo thought, it's got to depend on the size of the campus. If it's a 100-person campus, yes. If it's a 10,000-person campus, probably not. You know, we're up a little over 1% in terms of the positivity rate at UConn. That's concerning because we were at 0.5% just, 10 days ago. More to the point, we've tested well over 5,000 people there. We're continuing to test. One dorm that had a bit of a flare-up is going to be quarantined for a period of time. So I think if any college can get it right, it's UConn.
WTIC 1080 News.
Thanks, Max. Speaking of UConn and Mansfield, the mayor in Mansfield wants to reduce the maximum capacity to 10 indoors and 25 outdoors, which is well below your current state limit. And she and a few other mayors are looking for the individual authority to reduce those capacity limits. And they say they haven't heard back. So is there any progress on that?
The question was regarding indoor and outdoor capacity limits and whether it should be less for UConn or, say, a college town than it is for everybody else. And I think right now we're trying to do everything on a Connecticut-wide basis, not patch it out one way or the other. But obviously the strong recommendation is to keep those groups smaller. There'll be some additional police patrols there, so I think encouraging people to make sure they wear their masks and those big gatherings become small gatherings.
Nationally, there's a lot of violence going on, the double shooter in Kenosha, things like that. Are the state police and the security people looking out for threats like white nationalists, things like that?
Yeah, the question was look at the violence in Kenosha and maybe Portland and some other places, and what are we doing here in the state? Absolutely. You know, the state police, emergency operations, they're monitoring social media. They're keeping a close eye in terms of mainly those provocateurs, those folks who try and come in and create a confrontation. I think you've seen that in Kenosha. Thankfully, so far, Connecticut is at peace.
The Associated Press.
Thanks, Max. Governor, I'm sorry, I had some technical issues too. I couldn't hear your answers to the emergency order. Can you explain what was the thinking in terms of why you need to have those powers extended, and what will change, if anything?
First of all, I didn't want all those emergency orders to come to an end on September 9th, and you have a big rush in terms of what stores open and what bars stay closed and the such. We thought it was better for continuity to extend that a longer period of time. You know, Senator Fasano had recommended 4 months. Somebody else in the leadership said, let's take it out another month just so we have a month under our belt in terms of the legislature being in session. We don't have to rush to make any judgments. So that's why I think we all agreed that 5 months was a more appropriate period of time. And the 5 months, again, Sue, you know, gives our team the flexibility to move quickly if situations change. And I think that's what we learned was so important back in April, May, and June.
Yeah. And I'll just add this, Sue. So just from a process standpoint, so we will go through the process of filing this emergency renewal and declaration tomorrow afternoon. That will provide the legislature, the Committee of 10, the ability, if they would like to review that, and they can have 72 hours to either take no action or take an action of disapproval. As the governor stated, September 9th would have been a day of pure disruption in the state of Connecticut, and it would have made the state of Connecticut not as safe as it is today. Pure and simple, and that's why the governor's was moving forward to take the steps to take these actions to renew the emergency declaration.
Thanks for that. And Governor, given what happened at that Norwich nursing home, is there any move or any thinking on your part to rescind the civil immunity for nursing homes, given what happened there? That's something that AARP has called for, I know.
Yeah.
Not right now. But look, we've got sanctions, we've got penalties, we've got financial penalties, we relicense these folks. So, you know, I've got plenty of leverage there. Let's put it that way, Sue. But that's the type of thing we revisit under our emergency powers all the time.
And one other quick question. Are there any thoughts about using federal coronavirus money or maybe other state money for another round of bridge loans for small businesses?
Not yet. I mean, our COVID relief money is pretty well targeted. Obviously, we're doing more for education in schools than really any other state right now. And then our next biggest piece is testing. So I've got to be pretty careful there. And also, when it comes to those bridge loans, I do believe that at some point the Senate and the House are going to get their minds in one place, and I know that bridge loans and additional PPP is sort of unanimous on both sides of the aisle. It's something important to do, because there are a fair number of businesses that just aren't allowed to open yet. Those bigger indoor entertainment venues, bars, so these folks need some help. Even the restaurants at 50% capacity indoors. So we do think they deserve a second opportunity, and looking forward to that coming from the feds.
From the feds, okay. Thank you very much.
The Waterbury Republican American. Hearst, Connecticut Media. The Hartford Current.
Hey everyone, this is Emily Brindley from The Current. So the first question I wanted to ask about last week's uptick in cases. Just wondering what your guys' reaction is to that, and if you can tell me a little bit about whether or not you're concerned about that.
I'll start, then Josh, help me out. I think we've been traveling for 3 months in a very narrow band between 0.5% and 1.2%. And I know we spend a lot of time talking about a flare-up at a nursing home, a flare-up at UConn, a flare-up in Danbury. It gives us a sense that, oh my gosh, maybe things are slipping in the wrong direction. And I got to confess, I get these numbers every day, and I always hold my breath as Josh brings them in. And right now, I just feel like we're in a pretty good position. As I've said before, I feel very confident, Christine, about what we're doing at K through 8. I think the hybrid in the high schools, especially those busier high schools, makes some sense. I'm watching the universities just because they're bringing in kids from a wide orbit. And so far, we're about 2 weeks into that process, so it's a little early to tell. But right now, I'm feeling relatively confident.
Yeah, and I think, as you've seen, Emily, some of the increase in cases is a result of a significant increase in testing that's ramped up over the last several weeks as well. There's a lot of additional testing occurring based on our focused testing strategy on at-risk populations, but also with back to school. A lot of our colleges and universities are doing a lot of additional testing as they bring students back. So, as the governor said, the test positivity rate has remained very stable over a very extended period of time. So I think we're catching more of the cases with positive tests that have probably been out there for some time. The other key metrics to take note of is the hospitalizations, right? That is the real moment of truth of how many people are getting truly sick out there in the community. And we're at or close to our lowest levels of COVID-related hospitalizations we've been at since this began. The number of new COVID hospital admissions is at the lowest 7-day rolling average we've ever been at right now. So as the governor said, I think we're stable, but we're watching very carefully every day these hot spots and moving quickly to try to contain them.
Okay, fair enough. And kind of a similar question, over the weekend, Danbury still had dozens more new cases. So can you kind of square that for me with your feeling that the hotspot there has been contained? Because I heard you saying earlier that you feel like it's under control, but there are still a lot more new cases being reported there. So can you talk about that?
Want to take that?
Yeah, I think as the governor said, we're clearly not out of the woods. I think the metrics show that we've flooded in a lot of additional testing to Danbury. As you would hope to see when you bring in a lot of additional testing, the positivity rate has gone down. That's a good sign that it's not getting worse. But we do need to keep the measures in place that the mayor, in partnership with local health department and our state public health department and our colleges and our deep with the actions at the boat launch, et cetera. We need to keep those in place longer because even at 3.4% over the last 7 days, that's still much too high, right? We want to get that back down or near or under 1%, and that's the goal.
And last question for Dr. Carver. Can you talk to me a bit about any concerns that you have for your district, being a neighbor to Danbury? Do you have any concerns about that outbreak spreading into your district or affecting your school year?
So we've been closely monitoring with our local Department of Public Health official the impact that Danbury has had, because as you know, we are a neighbor to Danbury. And thus far, we are not seeing the spike coming into Bethel specifically. As the governor mentioned, we do get weekly data from the Department of Public Health by county. And then again, we certainly consult with our local health officials and are constantly keeping an eye on that.
Thank you. Appreciate it.
Connecticut Public Media.
Good afternoon. Concerning Three Rivers Nursing Home, did any of the staff that ended up becoming positive, were they tested and then during the period between being tested and getting their results entered the nursing home and were positive?
Yes.
And following that, do you think you're going to change the policy or the way they're tested to fix that problem in the future?
The nursing home testing that we've been doing is regular, it's repetitive, it's across the board, and as you can see in the other 211 nursing homes in the state of Connecticut, it's been extremely effective. We've driven COVID almost entirely out of the vast majority of the nursing homes in this state based on the testing protocol. So when it's followed correctly and it's partnered with all of the other important precautions that our Department of Public Health has put out there, particularly with regards to proper use of PPE and cohorting of infected patients, the current formula seems to work very well. So we just need our nursing homes, as the vast majority of them have been doing very effectively, to follow those guidelines and follow those rules, and we can keep our nursing home staff and residents safe.
Thank you.
I should just add, too, as Commissioner Gifford mentioned last week, we are continuing to refine and actually expand that testing protocol, too. So now even nursing homes that have tested completely negative for 14 days, we're still going to continue some surveillance testing of the staff, about 25% on average per week going forward, just to continue to keep our finger on the pulse of infections in those communities and make sure we stamp them out quickly if we see any more.
The Connecticut Mirror.
Governor, the minimum wage is scheduled to go up $1 tomorrow. There has been some complaints that small businesses are not set up to accept that right now. On the other hand, of course, we have a lot of low-wage workers who have been on the front lines of fighting COVID. So what's your view today about whether or not raising the minimum wage is still good public policy at this point?
I'm more convinced of that than ever, Paz. A lot of people are reluctant to get back to work, and there are a lot of frontline workers who were essential workers who worked, and a lot of them were earning the minimum wage. And a lot of them were, bagging your groceries or providing food, or some of them working in daycare. And I think I'm proud of the fact that Connecticut recognizes that, and they're going to give them a $1 an hour raise starting tomorrow.
Thank you.
CT News Junkie.
Thanks, Max. Governor, are we confident that as we go back to school, there seems to be a shortage of laptops for students, and most districts are doing hybrid learning? Can we guarantee that all the students have laptops that need laptops?
Well, words like highly confident guarantee are a little risky, I think, in this environment. I can tell you we got 120,000 laptops. We spent more on technology per capita than any state in the country. We worked really hard, Nick Simmons did, in terms of extending Wi-Fi, getting thousands of discount internet lines to homes that didn't have it. We solicited, going back well over a month now, anybody that thought they may need that support, get that support. What really worries me is we had a lot of people that had laptops, that had internet access last time, who never logged on. So that's something I think we've got to work hard on. Christine, for those 5,000 or 500 folks that aren't getting or going to go with distance learning, how do we make sure they actually take advantage of that? I know you're doing it on a synchronous basis, which means you're going to be integrated into the classroom. How do you make it work?
So yes, Governor, we are doing synchronous learning as part of our overall strategy for students that are on distance learning or in the hybrid during that short transition that we have at the beginning of school year. So we were very proactive in securing Chromebooks for all of our students, and we can monitor on a daily basis who's logging in to them, and that's also supported by other programs that we have in district that can monitor them in. And then if we are finding that students, and we had a very small percentage that didn't. That's where we utilize our social workers, our school counselors, our school psychologists, our classroom teachers to really reach out to families and to identify why they're not engaging, and then come up with specific strategies to ensure that they do engage in their learning. Sometimes it is connectivity, and we make sure that they have hotspots or access to devices. Sometimes it's simply if you have several students in the home that are all running, Zoom or Google Meets at the same time, making sure that the capacity for streaming is there. So, but the schools take a very proactive approach in meeting with families and identifying the reasons and ensuring that we get our students on.
And my next question is for Josh. Josh, are there any nursing homes right now that I know that there was an executive order that limited the testing for staff, that said you don't have to continue testing staff if you reach a certain threshold? I think it was like 14 days without a positive test. Are there any nursing homes that fall into that category right now?
Yeah, dozens. In the rule, just to be clear, is that you have to have 14 days, no positive test results of staff or residents. I get you the exact number, Christine, but I think it's actually the majority of the homes in the state have approached that threshold now.
Is that something that should continue, given that we do have this outbreak at this home?
Well, as the governor mentioned earlier, this case at Three Rivers seems to be a very isolated case as a result of not complying with a number of best practices around infection control, wearing a PPE, and so forth. So we don't view this as grounds to make wholesale changes to the policy. I think to the contrary, what we see in most of the homes in the state is when you follow the policies, you do the testing that the state's providing, use PPE properly, that we can control COVID.
Thank you.
Hearst, Connecticut Media.
Thanks, Max. Sorry about my technical inabilities there. Governor, could we go back to last week when the CIAC decided that they know more about the health of athletes than the Department of Public Health? I think we reporters failed to ask what kind of repercussions the CIAC might be facing in their refusal to abide by the DPH guidelines on volleyball and football in the fall.
Yeah, I'm going to go slow on that, Ken, in this sense. Deirdre in Public Health and Scott Gottlieb and Zeke Emanuel and Dr. Coe, they've all said, look, I think indoor volleyball and football, which is close contact, is probably the highest risk sport you can do. And they frown upon it and they discouraged it and said, why don't you put it off to the spring? That said, the CIAC, as far as I can understand, they're doing practice in narrow cohorts right now, so they're going to limit the nature of the spread. The practice is going to go on for another few weeks. We'll have a chance to see what COVID looks like by mid-September and be able to make a good considered judgment then. I don't think we have to jump ahead of that. And as I've said before, CIAC did the right thing back last March, under considerable heat, I would say, when they said it's not going to work for basketball. So let's give it a little time.
And Governor, when was the last time you got an update on the finances of the state hospitals? Generally, can you give me a picture of what that looks like?
I can tell you that the state hospitals, performed brilliantly during this pandemic, and where there was a pretty competitive environment between us and them, and amongst themselves, worked together as one. They took a hit, no question about it. When there's a lot less of that elective surgery going on, quote unquote elective surgery, meaning non-urgent surgery, that hit their bottom line. Different hospitals have been impacted in different ways. Melissa McCaw runs finances, is put in place right now, I believe it's $75 million out of our COVID relief fund, at least to help out those hospitals most in need. And in the meantime, we continue to work with our congressional delegation in terms of what other support there will be for our hospitals going forward.
Thank you.
All right, well, I just say the June 30 numbers have come and gone. We're getting a lot of analysis from Moody's and Barron's. Long term, let's face it, we still have fiscal challenges, which I'm not going to understate. Near term, we got a pretty good report card that now it's closer to 85, 86% of our economy is back up compared to pre-COVID. That puts us, really in the top tier of states out there. We've done pretty well on the unemployment. That puts us average or above average. What's the difference? That we had a lot of people knocked out in the service sector there. I love the fact where we are in terms of our COVID metrics. I think you ought to be all taking a look at Bethel. This is a great school system with a great superintendent. They're opening cautiously, a place your kid can get back into the classroom, see his or her friends, see his or her classmates in the very near term, and showing that I think if we proceed with caution, we can get it done together. Thanks, everybody. Thanks, Christine.